Our special edition on COVID-19 will take you now to the Federal Capital Territory, where our correspondent Friday Okerebe joins us now. Friday, how are citizens preparing for the lockdown in the Federal Capital Territory today?
Thank you, Millicent. Welcome to Abuja. I can tell you authoritatively that residents in the Federal Capital Territory are actually aware of the total lockdown that we commenced from 11 p.m. today, and many of them are actually preparing for that. This morning, there is a long queue. There are long queues at the ATM and even at the filling stations. A lot of persons are driving in to buy fuel. I'm sure this is in preparation for the lockdown, the total lockdown that the president actually made reference to during his broadcast yesterday. So, right at the city center, a lot of persons are aware already that after 12 midnight today, you won't be allowed to go out. Although the little allowance for movement is there this morning, they are using the opportunity to actually buy in whatever they can get and keep them as stock in their houses in preparation for the total lockdown later today. I must tell you also that the FCT administration, they have an enforcement agency that will be ensuring that residents comply with the stay-at-home directive. Starting from Saturday, they'll be going around the city center to ensure that people who are not selling essential commodities, their shops are locked. Those who are supposed to render essential services, they are allowed to move freely. And yesterday, they also went around the city to ensure that churches comply with the directive not to open their places of worship to worshipers to come in, so that the population of people moving in the city will be really, really reduced. They ensured that some persons who wanted to disobey that order were actually made to obey it, because the few churches that opened yesterday, they ensured that they are locked up, and already some pastors are already taking alternative means to reach out to their worshipers. So I can tell you that the lockdown is real at the FCT in the Federal Capital Territory, and citizens, especially those who are living in the city center, with the exception to those who are in the suburb who are still trying to understand what is actually happening. In the city center, people are actually complying with the directive to stay at home.
Friday Okerebe, we'll try to catch up with you a little later on today. But joining us for more on the level of awareness in Nigeria and measures by the government to curb COVID-19 is a doctor, a public health physician, Dr. Adeleke Awolesi, a member of the Association of Public Health Physicians of Nigeria. Thank you for joining us on the program.
Thank you, ma'am.
So looking at the sweeping measures, especially by the president to curb it, how significant is Lagos and Abuja in fighting the spread?
Well, if you have seen the pattern of spread, you would have noticed that one, COVID-19 is an imported disease. I want to use that word. And Lagos State is the commercial hub of the country, and most cases we've seen have come through Lagos. And Lagos presently has the highest number of cases, followed by Abuja. So the two states are strategically important to help to mitigate against COVID-19. If you lock the two down, you have a higher chance of containing the spread.
But studying what we have in other parts, take for example China, there was a lockdown, and it seems they're coming out of that phase. But Italy, there's also over 2 weeks lockdown, but they've had a lot of deaths.
Yes. If you notice, what China did was what we call a cordon sanitaire. They locked down the country. Italy did not follow suit. They relaxed, and towards the ending, they started locking down. What China did, if you listen to them, they acted very fast. Their CDC director said, we acted fast. Acting fast is part of, and there was a total lockdown. The government invited the military into the lockdown. They did that. They locked down the whole of the Hubei province, a province of about 56.2 million people, and placed them on a 10-day isolation. No movement. There was absolutely no movement in that region. And that was, if you listen to what they have been saying, that was very important to their success. And Italy has not done that. They've relaxed their testings. They don't even do testings for people who have mild to moderate COVID-19 disease. What you will notice is that 40% of people who have COVID-19 will have mild symptoms. and then another 40% will have moderate with pneumonia. These people, though asymptomatic, could still spread. They have 55% chance of spreading this virus, and that is what is happening in Italy.
So in looking at the lockdown and containing the spread, our fact and fiction, the face mask, what does it really do?
Well, WHO has told us that you cannot use this face mask in isolation. You must combine it with proper hand washing. They have even advocated that we should stop using it, except one, you have the disease. Two, you are taking care of a member of your family that has the disease, which of course is not advisable, except the person is self-isolating. Most of us, at least an average human being, would touch their face, their nose, and their mouth 20 times in 1 hour. And so many of us, I was discussing with one of your colleagues here, and I saw him, touching the face mask. We shouldn't do that. I see a lot of people wear face masks. In fact, I was almost getting into a fight with a bank manager. Why are you wearing gloves? She was all gloved up, and she was also using a face mask. So if you have to use a face mask, the recommendation is that you don't touch it, and you must always wash your hands.
All right. We'd like to appreciate your time, Dr.
Yes,
Adeleke Awolesi, Member Association of Public Health Physicians of Nigeria, for joining us.
Thank you.
Well, the Benue State government has ordered the closure of all land borders with Nasarawa, Taraba, Cross River, Ebonyi, Enugu and Kogi states starting from April the 1st, 2020 as part of measures to curbing the spread of COVID-19 with the confirmation of one positive case in the state. Governor Samuel Ortom in a state broadcast asked all citizens to comply with the directive, which include a dusk to dawn curfew, the closure of all markets, mosques, churches and all public festivities. Over in Kaduna, our correspondent there brings us up to speed on the status of the governor who has since tested positive to COVID-19 and the compliance levels in the state.
Over the weekend, Governor Nasir El-Rufai of Kaduna State announced that he was tested positive for COVID-19 and has therefore gone on self-isolation. The governor is now the first index case in the state. But before announcing his status last weekend, El-Rufai had in the past 10 days or more attended several functions in the nation's capital, Abuja, including the meeting of the Nigerian Governors Forum and the National Economic Council meeting, which was held at the Presidential Villa, Abuja, before returning to Kaduna State, where he also held some meetings and also led the campaign against COVID-19. And in line with the NCDC protocol, we were told that members of his cabinet, some of his close aides, and persons who have had contact with him, including his family members, are now on self-isolation for 14 days. Here at Sir Kashim Ibrahim House, the state seat of power, the usual bubblings and high influx of visitors on weekdays like this have whittled down. We were told that the deputy governor will oversee the affairs of the state at the moment until the governor comes out of isolation. Meanwhile, the news of El-Rufai's positive test status for COVID-19 has attracted reactions from the people of the state who have expressed sadness and also wishing quick recovery.
I feel sad because I see him as one of the person who is struggling for the prevention of this COVID-19. So I feel sad about it.
Our correspondent there, Chimezie Inyocha, Kaduna State. Well, let's tell you what's happening around the world. There appears to be excitement in Wuhan, the International Plaza, one of the city's largest malls that is home to luxury brands, including Louis Vuitton and Cartier, among the retail complexes, shopping streets that reopened today after being closed for more than 2 months. Elsewhere, we appear to have more COVID-19 cases reported in East Africa. The number of confirmed cases there have increased. Rwanda reported 10 new cases on Sunday, taking the total number in the country to 70. That's the highest in the region. Eritrea confirmed 6 more cases, bringing the total number to 12. Ethiopia has also reported 5 more cases, also in Kenya, Uganda, and Tanzania. And we hear some 20,000 former NHS staff have returned to work to help fight against COVID-19. Boris Johnson revealed in a video posted online. The Prime Minister, who's self-isolating, revealed also that the country would get through the crisis, he says, together. And finally, U.S. President has extended the coronavirus guidelines, such as social distancing across the country, until at least the 30th of April. He previously suggested it could be relaxed as early as Easter, which falls mid-April. He appeared to be referring to peak infection rates that experts fear could overwhelm hospitals. Well, the World Health Organization's website is live for many more updates on the pandemic. And each moment, depending on what part of the world you're in, it keeps updating the number of cases, which has exceeded 600,000. As you can see there, also the number of deaths exceeding 30,000 and the regions and areas that it has gotten to. You can also indeed take a look at some of the numbers in real time and several other advice there on the website. And that's our COVID-19 special edition on Channels Television, your home for the news. Thank you for watching. Another 30-minute update comes your way again at 6 p.m. and later at 9 p.m. Thanks for watching. I'm Millicent Walker.